The United States is facing an unprecedented surge in viral illnesses. This quad-demic involves four major players: COVID-19, influenza, respiratory syncytial virus or RSV, and norovirus. These viruses, each with unique symptoms and modes of transmission, are converging simultaneously, posing a significant threat to public health. This perfect storm of respiratory and gastrointestinal illnesses is overwhelming healthcare systems and raising alarm bells across the country. The situation is particularly concerning as we head into the heart of winter, a time when respiratory viruses typically peak. The confluence of these four viruses is creating a perfect storm for widespread infection, particularly among vulnerable populations such as young children, the elderly, and those with weakened immune systems. The current surge highlights the importance of understanding these viruses, their potential impact, and the steps we can take to protect ourselves and our communities. Data from the Centers for Disease Control and Prevention paints a stark picture of the current situation. COVID-19 cases, while lower than last year, are steadily rising, fueled by new variants and waning immunity. Influenza, which had a relatively quiet presence in recent years, has roared back with a vengeance. RSV, a common respiratory virus that typically causes mild, cold-like symptoms, is hitting young children particularly hard this year. Norovirus, a highly contagious stomach bug, is also on the rise, causing widespread outbreaks in schools and healthcare facilities. The CDC reports that emergency department visits for respiratory illnesses are at their highest level in a decade. Specifically, influenza-like illnesses are exceeding levels typically seen at this time of year. RSV hospitalizations are also surging, with some hospitals reporting they are at or near capacity. Norovirus outbreaks, often characterized by vomiting and diarrhea, are further straining healthcare resources. The surge in viral illnesses is placing an immense strain on hospitals across the country. Emergency rooms are overflowing with patients seeking treatment for respiratory and gastrointestinal symptoms. Hospitals are facing shortages of beds, staff, and essential medical supplies. The situation is exacerbated by a shortage of healthcare workers, many of whom are burnt out and leaving the profession after years of battling the COVID-19 pandemic. This strain on the healthcare system has serious consequences. Patients may experience longer wait times in emergency rooms, delayed diagnoses and treatments, and even difficulty accessing critical care when needed. The situation is a stark reminder of the fragility of our healthcare system and the importance of taking steps to prevent overwhelming it. In the face of this quad-demic, prevention is our most potent weapon. Simple yet effective measures can significantly reduce the spread of these viruses. These include frequent hand washing, covering coughs and sneezes, staying home when sick, and getting vaccinated against influenza and COVID-19. It is crucial to stay informed about the latest developments in public health recommendations. By taking these proactive steps, we can protect ourselves, our loved ones, and our communities from the threat of these viruses. We must all do our part to mitigate the impact of this quad-demic and prevent further strain on our healthcare system.